Schumer, who is the corporate Senate Minority Leader, has been channeling his full Bernie Sanders as of late. We've covered his two main comments, and now we're getting to the third one. Previously, he had said that their main goal, the Democrats' main priority, is healthcare, not Russia. And he has said that it was Hillary Clinton's fault for losing. It was not, Russia. That wasn't the reason. He said, look, if you lose to someone with a 40% popularity, I think that you should self-evaluate, which was truly remarkable. And like I said, channeling full Bernie Sanders. I think he's, in this moment, trying to gain some steam from the progressives and from the Bernie Sanders backers. I mean, for me, if he does this, if it helps the Democrats win, whatever. Because we all know, as progressives, the way to win is to run through on the substance, not say Russia, 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 but instead say, hey, single-payer healthcare that the Republicans won't be able to repeal, $15 minimum wage, etc., etc. But Chuck Schumer has said something else. Chuck Schumer says Senate Democrats are open to single-payer healthcare. So this is going to be, it's been like a domino effect here. And I think this has been like this kind of like huge synapse in everybody's mind. It's like, whoa, because of the fact that Obamacare is literally 2 or 3 senators away from being repealed, I think people are starting to realize, holy crap, we need something that will be solidified that can't then be repealed. The only thing you can do is single payer, because anything else you'd have to pray to God, and you'd also have to win every fucking election to obstruct any attempts at repeal. And that's impossible. It's impossible because everything is tit for tat, unfortunately, and obviously bad decisions. But this is the way to go, and this is how you're going to win elections. And moreover, this is the correct policy position. But HuffPost says, they say, Senate Minority Leader Chuck Schumer argued Sunday that it's time for the Democratic Party to take a, quote, bold approach on economic issues. Adding a single-payer healthcare system is, quote, on the table. It better be front and center on the table. Okay, Schumer? It better be front and center on the table. Continues, says, appearing on ABC's This Week, Schumer previewed the economic agenda his party plans to roll out this week. He acknowledged that Democrats failed to win over voters in the 2016 election with a clear economic message, and said his coalition plans to change that. Quote, we were too cautious. We were too namby-pamby. What the hell? This is sharp, bold, and will appeal to both the old Obama coalition and the Democratic voters who deserted us for Trump, he said. So, the Obama coalition, I guess, would be the neoliberals. And then you have the Democratic voters who deserted us for Trump. There aren't that many of those. There aren't that many of those. Mainly what you have are Democratic voters who either went green, libertarian, or they just didn't vote. What you would call a protest vote. They say ABC's George Stephanopoulos pressed Schumer on whether that would include support for a single-payer healthcare system in which the government, rather than private healthcare insurance companies, would pay for care. Quote, we're going to look at broader things for healthcare. He said, single-payer is one of them. One of them? What else is there? All you have is the public option, and you have the private health insurance. There's no other system. You can have a pre-Obamacare system, or you can have an Obamacare system, or you can have an Obamacare system with the public route, or you can have a single-payer system. That's really all of your options. There aren't really that many things, and with the Republican Party, that's essentially going to obstruct anything you do. You have to get a supermajority to get single-payer in, because if you fight and go to war for the whole time and get single-payer passed once, it's over for the Republicans. It's done. Many things are on the table. Medicare for people above 55 is on the table. That should be a guarantee, okay? It should be 55. In fact, I would lower it to 50. Anybody above 50 or above should be able to get Medicare. A buy-in to Medicare is on the table. Buy-in to Medicare, why did we say that? Medicaid is on the table, sorry. On the broader issues, we will start examining them once we stabilize the healthcare system. The healthcare system is stabilized in terms of Obamacare. Obamacare has ran its process. The website got better. You know, the premiums have been solidly going. It's at a lesser rate than it would be without Obamacare. 30 million people now have insurance who didn't previously have insurance. Medicaid has worked absolute wonders. The Medicaid expansion has done amazing. I mean, it's stable right now until the Republicans flip those 3 senators and then they repeal the damn bill. Okay, so you have to go to single payer. I like that they're tiptoeing on it, but they need to move forward. Like Kamala Harris saying, you know, I agree with the concept. Dude, you can't just say that because then nobody cares about you. You don't stand for anything. You're just a somebody who wants to stick with what we have now, which can literally be repealed, like with the high five, and it's gone. What's up, guys? It's Saul Hill here. You guys are watching The Progressive Voice. Make sure you guys click subscribe down below. We're fighting Donald Trump tooth and nail, and we need your help.